Okay, let's continue on with just a brief explanation of renal filtration and urine concentration. So, basically, what happens is blood enters the glomerular capsule, and here we go. I'm sorry, I'm getting my pen set up here. And as the plasma and different compounds escape, here, let's go back one slide here. As the plasma and compounds like salts and waste products exit out into the capsular space here, blood will continue flowing through these arteries and exit through the afferent arteriole. So glomerular filtration, which is going to be, or filtrate here, which is going to be the fluid that heads towards the proximal convoluted tubule, is going to contain lots of salts, lots of components in it. And at this point, in the proximal convoluted tubule, you're going to see some reabsorption of water, some reabsorption of other molecules that the body might need. So say, for example, some glucose escapes through the podocytes, okay, into the glomerular capsule. Well, at the level of the proximal convoluted tubule, water and maybe some glucose gets pumped back into the bloodstream. Now, so let's draw a little picture here. So let's say that this is the glomerulus. Here's the proximal convoluted tubule going down. At the junction of the proximal convoluted tubule and the loop of Henle, which is going down into the medulla, right? So this is going to be the loop of Henle. The filtrate is going to be flowing downwards. And in this descending loop of Henle, you're going to be seeing reabsorption of water here. That happens through a process called countercurrent exchange, or the countercurrent multiplier system here. You will hear a whole lot about that in physiology. Okay, so we have urine or filtrate flow going down here, going back up through the ascending loop, through the distal convoluted tubule, and then out through the collecting duct. Okay, so you have fluid flowing in this direction. So basically, this region here, right here, the loop of Henle, is where you're going to see most urine concentration occurring. Okay. Now, the filtrate will go up through the distal convoluted tubule, where you have the final concentration of urine, more water is removed there, and then the urine goes out into the collecting duct, moves out of the kidney and into the urinary bladder. So, basically what's going on in terms of blood supply. At any given time, 20 to 25% of our blood, or our cardiac output, goes straight to the kidneys. It first starts at the renal artery, goes down to what we call segmental arteries within the kidney. Then you have the interlobular arteries, arcuate arteries, interlobular arteries, and then afferent arterioles eventually. Right here, after the afferent arterioles, remember this is where the glomerulus, that little round capsule, has the arteries with the podocytes, the fenestrated capillaries basically, where filtration happens. The blood then goes to the efferent arteriole, then the peritubular capillaries, the venules, interlobular veins, arcuate veins, interlobular veins again, and then the renal vein out to the rest of circulation. The process by which our blood is cleaned by our kidneys is called hemodialysis, or dialysis, right? This is where blood is filtered. And basically, if somebody has damaged kidneys, it's impossible for the kidneys to work properly to dialyze or remove salts and waste products from the blood. Therefore, you will not see completely dialyzed blood in the renal vein. All right, you're going to talk a whole lot more about that in physiology, so I'm going to stop there in terms of what dialysis includes. So now let's look at what happens to urine after it flows out of the collecting duct into the renal calyx, out of the ileus, and then out into the ureters. So we're looking at a male pelvis and a female pelvis. And as I mentioned before, the male urinary system has two purposes. The first purpose, of course, is to remove urine from the urinary bladder, to remove waste and extra water and salts and so forth. But the male urinary system also serves for fertilization. in reproduction. So over here in the male pelvis, you'll see in this example the left ureter coming down into the urinary bladder. We'll look at the right ureter in a few minutes in the female. The urinary bladder drains into the urethra, which is right over here. Okay, so the urethra comes up right through here. The urethra travels through the prostate gland, and the prostate itself has certain jobs that we'll talk about in another lecture. The urethra then drains down into the spongy urethra and then exits through the external urethral orifice, all right? So you can see here the connection between the reproductive system, which includes the testes, the tubules. I don't want to go into all the details. The vas deferens that connects over here to the prostate and so forth. We'll talk about that in more detail later, but you can see the connection between the male reproductive system here and the urinary system. Now, in the female reproductive and urinary system, you don't see a crossover. So the urinary bladder is right here. It's a more flattened structure in females. It resides underneath the uterus. So it's inferior to the uterus. Here's the uterus here. The uterus is associated with, of course, the fallopian tubes and the ovary. Here's the right ureter, which would be draining. You can't see what's going on here, but the right ureter will drain into the more superior portion of the urinary bladder. The urinary bladder in females tends to stay a little bit more flattened, like I mentioned, because it is underneath or resides inferior to the uterus. The urinary bladder drains straight out to the urethra, which then releases urine into the environment, urine and waste products. So in this particular case, one of the issues that females tend to have quite often is urinary incontinence, especially during pregnancy, because the growing fetus puts pressure on the urinary bladder. So oftentimes in pregnancy, females, or women, I shouldn't say females, but women will have a urinary tract infection simply because of the pressure that the developing fetus puts on not only the urinary bladder, but sometimes the ureters draining into the urinary bladder, blocking the flow of urine out of the urinary bladder. And in that particular case, if bacteria, just genital bacteria from the environment, go up into the bladder, they can also travel up the ureters and give rise to a kidney infection. So that sometimes happens because there is limited urine flow during pregnancy. So the ureters themselves are about 1 foot long. They come down from the kidneys. They descend from the kidneys. They attach in what we call the superior lateral angle to the bladder. So it's on top and kind of on the sides. Urine actually doesn't just flow downhill through the force of gravity. There's actually peristalsis of smooth muscle associated with the ureters themselves that move urine from the kidneys down to the urinary bladder. So there are 3 layers of tissue. Oh, here we are again, more tunics. The tunica mucosa, which is a stratified transitional epithelium inside the ureter. So that's the deepest layer of the ureters, and the mucosa is what touches the urine itself. And of course, there's mucus there that allows the smooth flow, that helps facilitate the smooth flow of urine from the kidneys to the urinary bladder. There's the tunica muscularis, which has lots of circumferential smooth muscle that undergoes peristalsis to move urine from the kidneys to the bladder. There's also an inner layer of longitudinal muscle, which helps facilitate peristalsis. And then we have the tunica fibrosa, which is lots and lots of connective tissue connecting the ureters to the posterior abdominal wall of the body. The urinary bladder itself is a big pocket, a muscular pocket. It functions to store urine. It's made up of the fundus, the neck, and the trigons. So the fundus is up on top. The neck of the urinary bladder is way down here on the bottom, and the trigon is this, what looks kind of like a triangle when you look at it in this section, but really what's going on here with the trigon is, if you think about this shape, this is like a funnel. So think about this 3-dimensionally in terms of a funnel leading down to the urethra. So the interior surface of the urinary bladder is made up of these small pockets, these little rugae, just like the stomach, that allow the urinary bladder to expand and relax as it fills and empties with urine. There's plenty of detrusor muscle over here. The urethra, I'm sorry, not urethra, ureters drain up here in the superior lateral aspect of the urinary bladder. There's the median umbilical ligament helping support the urinary bladder, and then there are the lateral umbilical ligaments. There is the left and the right. The urethral openings come all the way down here, and so the urinary bladder fills from the bottom to the top. All right, the urethra doesn't dump in the top. The urethra exits right here at the trigone. And then we have the neck of the urinary bladder that, as this internal urinary sphincter here, remember sphincters are circular muscles, round muscles. As this opens, it allows urine to flow from the urinary bladder down into the urethra. In the male, here's our prostatic urethra, which goes through the prostate. And then you have the membranous urethra down here next to the external urethral sphincter. So that's near the junction of the abdominal cavity of the body. The urethra itself is a tube from the bladder to the exterior of the body. Definitely much shorter in women, or I'm sorry, yes, in women than in men. And there are two sphincters, the internal sphincter, which we do not have control over, and the external sphincter, which we do have control over. And so the structure of the bladder itself is basically a whole lot of smooth muscle. There's the lumen of the urethra here that they're showing you, the squamous, stratified squamous epithelium of the mucosa that is basically a barrier keeping urine from going out into the tissue. The lamina propria containing lots of mucus epithelial cells, and then a big smooth muscle layer here. You have the circumferential and the longitudinal. See, this goes kind of wraps this way, and these would be running in and out of the frame of the picture here. So we're looking at that was the female urethra. The male urethra looks exactly the same, it's just longer. The ureters themselves look similar, it's just that there's a whole lot less smooth muscle. You don't need a whole lot of smooth muscle to move urine from the kidneys down to the urinary bladder. And then, of course, the urinary bladder, an extensive detrusor muscle helping to smoothly contract and push urine out of the urinary bladder. All right, that's the end of this lecture.